Merci beaucoup tout le
Thank you
monde.
very
Bon
much,
après-midi.
everyone, and good
Today
afternoon.
I am joined by my colleague, Minister Haidu, Minister Blair, Minister Algabra, and Minister Mendocino. Alors, je voudrais maintenant inviter
I would now
notre
like
collègue, la ministre
to
de la
invite our
Santé,
colleague, the
Patty
Minister of
Haidu,
Health,
à
Patty
prendre la
Haidu,
parole.
to
So,
speak.
Patty, over to you.
Merci Dominique et
Thank
bonjour
you,
tout le
Dominique,
monde.
and
Il
hello,
y a
everyone.
quelques semaines, on a dit aux Canadiens
A
que
few
si la
weeks ago, we
vaccination
told Canadians that
continuait à
if vaccination
progresser,
continued
on
to
pourrait
make
faire des
progress,
ajustements aux
we
mesures à
could
la frontière.
adjust the border
Même si
measures.
les 18 derniers mois
Even
ont
though the last
été
18 months
difficiles,
have been
on voit
difficult,
que les Canadiens
we can
continuent
see that
à se
Canadians
faire
are
vacciner
continuing to
et
get
respecter les
vaccinated
mesures de la
and
santé
following
publique.
public health measures.
As of today, nearly 80% of eligible people in Canada have received at least one shot of a COVID-19 vaccine, and over 50% are fully vaccinated. This is no small feat. I am so proud of Canadians for stepping up to protect each other, and I thank everyone working so hard to ensure that all Canadians have access to vaccines in every one of our communities. Thanks to the hard work of Canadians who have followed public health measures and stepped up to get vaccinated when it was their turn, we're in a much stronger position to be able to further ease border measures for fully vaccinated travelers. In March of 2020, we implemented some of the strictest border measures in the world. We restricted non-essential travel and we prevented the importation of COVID-19. On September 7th, we intend to allow entry for fully vaccinated travelers from any country for non-essential traveler. Travelers will have to be fully vaccinated with a Health Canada authorized vaccine at least 14 days prior to entering the country. But ahead of that date, on August 9th, a number of important changes at the border will come into effect to allow fully vaccinated United States citizens and permanent residents who are currently residing in the United States to enter Canada for non-essential purposes. The same requirements will apply. Travelers will have to be fully vaccinated with the Health Canada authorized vaccine at least 14 days before entering the country. Our approach at the border has always been based on the latest science and evidence. This approach will be, the relaxation of measures will be a gradual process, taking into account the vaccination rate of Canadians and our own epidemiological situation. These changes will also mean adjustments to other measures at the border and on arrival for vaccinated travelers arriving in Canada. All travelers, regardless of vaccination status, will still need a negative pre-departure test. However, starting August 9th, we will shift to a mandatory randomized testing for fully vaccinated travelers. So only those that have been randomly selected will need to complete a day one test. This shift allows us to focus efforts on unvaccinated travelers while still keeping track of new variants. Also, as of August 9th, the 3-night government-authorized hotel stay requirement will be eliminated for all air travelers. Travelers will now be able to go directly to their quarantine location to complete their 14-day quarantine. I'll take this opportunity to thank the many hoteliers across the country who stepped up to support Canadians and did such a phenomenal job. Last month, we also told families we would look at the quarantine requirements for children. Today, I can confirm to families traveling with children under 12 that children will be exempt from quarantine, but they will still have to follow strict public health measures. This means they can accompany their parent or guardian out of the house to their destination so long as they avoid group settings like summer camps, school, or childcare for 14 days. The current testing and quarantine requirements will not change for unvaccinated or partially vaccinated travelers. They will still be required to complete their 14-day quarantine as well as day 1 and day 8 tests. It has been nice to be able to see friends and family this summer, but we do see international evidence that the pandemic is not over. Thanks to the hard work of Canadians, things are much better here in Canada. And our progress has been hard-won. It is very important, and we cannot risk it. We are all excited to reunite with friends and family. But if we're going to be able to continue to see this progress, we need to continue to be safe. So please, if you haven't already, get vaccinated. If you know someone in your community who needs help to get vaccinated, lend a hand. And if you're not feeling well in any way, stay home, and reach out to get tested. Together, we can continue to protect each other and get our lives back. I really look forward to your questions. Thank you very much.
Good afternoon, everyone. I'm very pleased to be speaking to you today from the traditional territory of the Mississauga of the Credit. Since the very start of the pandemic, the government has acted with the utmost caution to protect the health and safety of Canadians and to deal with this global challenge. That was the case in the very worst days of the pandemic when we implemented strong measures to secure our borders. And it remains the case now with the approach that we are taking to ease those measures in steps with what we believe to be decreasing risks. Let me acknowledge that this has been very difficult. I had a conversation earlier today with the border mayors of Ontario, and they made it very clear how difficult this has been for their citizens and for their communities. We recognize that people are anxious for the border reopen. But from the outset, we have taken a cautious and careful approach, and we will always put the health and safety of Canadians first. Today's announcement is a step in that direction, while maintaining key restrictions that are necessary to ensure that we can continue to control the spread of COVID-19 and its variants. Starting at August 9th, as Minister Hajdu has indicated, fully vaccinated American citizens and permanent residents will be able to enter Canada for discretionary travel provided that they are currently residing in the U.S. and that they are arriving from the United States. That will be followed on September the 7th by the reopening of our border to discretionary travel, but for fully vaccinated travelers from any country who meet specific entry requirements. If they are eligible to enter Canada, fully vaccinated travelers will no longer have to quarantine upon arrival. The earlier start date of August the 9th for fully vaccinated American citizens and permanent residents is an acknowledgement and recognition of our shared border and our close relationship with the United States. It will give us the opportunity to test our processes and to ensure that they are effective in maintaining the health and safety of Canadians. This means that vaccinated U.S. travelers will be able to visit Canada, but it's important to note that the U.S. has not announced a reciprocal reopening of its border at this time. While each country will make its own rules and regulations, we have agreed that any move to adjust restrictions will be guided by science, as well as the potential risks to public health and operational capacity at our shared border. We will continue to have regular conversations with our U.S. partners to ensure the safety, security, and economic well-being of our respective countries. On August the 9th, to enter Canada, eligible fully vaccinated American citizens and permanent residents must also meet the pre-arrival testing requirements. In other words, they must continue to provide proof of a valid COVID-19 molecular test as is currently required. They must also be asymptomatic, and they must provide contact and travel information and proof of vaccination in English or French electronically through the ArriveCan app before arriving at our border. It's important for travelers coming to Canada to have their ArriveCan receipt and documents ready, including a digital or paper proof of vaccination before they arrive at the border. Likewise, it's the traveler's responsibility to plan ahead before heading to the border to ensure that they meet all mandatory requirements for entry. Once at the border, travelers must provide the required information and documents so that the Border Service Officer can determine if they may enter Canada. And they must also answer all vaccination and health screening questions. All travelers must also still present a suitable quarantine plan and be prepared to quarantine in case it's determined at the border that they do not meet all of the conditions required to be exempt from quarantine. Currently, all travelers arriving in Canada are subject to mandatory on-arrival test. Starting on August the 9th, a modified surveillance-based testing strategy will be implemented at select airports and land border crossings for fully vaccinated individuals. There will be no changes to the mandatory testing requirements for unvaccinated or partially vaccinated travelers. And to reiterate, the changes that we've announced today take effect on August the 9th for fully vaccinated American citizens and permanent residents who are currently residing in the United States, and beginning on September the 7th for fully vaccinated travelers from any country who meets specific entry requirements. And until then, all foreign nationals coming to Canada for discretionary travel purposes, such as tourism, will be turned away at our border. This includes those who are fully vaccinated. And additionally, As of August the 9th, Canadian citizens and permanent residents traveling to the United States for less than 72 hours will be allowed to take their pre-entry test in Canada prior to their departure, and it will remain effective and in effect for the full 72 hours. Today's announcement follows discussions and consultations with our provincial and territorial partners, as well as our counterparts in the United States and around the globe. These border decisions are guided by facts, scientific evidence, and the best advice available from our public health experts. Our top priority must continue to be the health and safety of all Canadians. And that's why we will continue to monitor the public health situation in Canada and around the world, including vaccination rates and risks posed by the variants of concern. Should the situation evolve in any way which is concerning, we are prepared to adjust our border policies as necessary. Thank you very much. And I'd now turn the floor over to my friend and colleague, Minister Alghabra.
Thank you very much, Minister Blair. Good afternoon. Good morning, everyone. Bonjour à tous.
Hello, everyone.
I also would like to begin by acknowledging that I'm speaking with you from the traditional territory of the Mississaugas of the Credit First Nation. Today, as we continue to see positive progress in the public health situation, I'm pleased to provide an update on the transport front for our reopening plan. Our government is committed to taking a cautious approach to ensure the safety of Canadians and the safety of all travelers who are authorized to enter Canada. Since the spring of 2020, international passenger flights to Canada have only been allowed to land at 4 airports: Montreal, Toronto, Calgary, and Vancouver. International passenger flights to Canada will now be allowed to land at 5 additional Canadian airports: Halifax, Quebec City, Ottawa, Winnipeg, and Edmonton. Les voyageurs internationaux
International passenger
attirer
flights to
à
Canada
5
will now be
aéroports
allowed to
supplémentaires.
land at 5 additional Canadian
Transport
airports.
Canada will work with these airports and their airline partners, along with the Public Health Agency of Canada and the Canadian Border Services Agency, to put in place the measures necessary to start to safely welcome international passengers at these airports as soon as possible after August 9th. After these 5 airports, we will be prepared to work with other airports interested in reestablishing international flights as international travel volumes and public health conditions evolve. Earlier this month, we removed the requirement for airlines to perform pre-departure temperature screening of international air passengers coming to Canada. With the public health situation improving, we are also eliminating pre-departure temperature screening for domestic air passengers and passengers departing Canada on international flights, as well as for airport workers. And the temperature screening requirements will be fully eliminated as of August 9th. I want to emphasize that these changes are only possible due to the extraordinary commitment Canadians have shown, following public health advice and getting vaccinated in incredible numbers. So let's keep the momentum growing. If you haven't done it yet, please get your shot. I also want to stress that there are still necessary public health measures that remain in effect, including wearing masks at airports and on board all flights to, from, and within Canada. And all international passengers, vaccinated or not, must still present a negative COVID-19 test result prior to boarding a flight to Canada. I'm also announcing today that the restriction on direct commercial and private passenger flights to Canada from India is being extended for another 30 days until August 21st. Nous prolongeons la restriction pour la
We
vol
are extending
direct
restrictions
de l'Inde.
for direct flights
While
from India.
progress is being made, the situation in India is still very serious. This extension is based on the advice received from Public Health Agency of Canada and will best protect Canadians from an increased introduction of the Delta variant, which is prevalent in India. As a reminder, Passengers who depart from India for Canada via an indirect route must still obtain a valid COVID-19 test result from a third country before boarding a flight to Canada. In order to take advantage of the ability to resume international travel, it is crucial for travelers to properly demonstrate that they are fully vaccinated according to Canadian standards. Starting August 9th, air carriers will begin verifying that travelers coming to Canada have submitted their COVID-19 information digitally through the ArriveCan app or website before boarding a flight. This includes information and documentation to demonstrate that they are fully vaccinated. This will apply first to U.S. citizens and U.S. permanent residents who travel to Canada from the U.S. for discretionary travel on or after August 9th. On September 7th, foreign nationals from other countries will be permitted to come to Canada for discretionary travel, and they will also need to provide proof that they have been fully vaccinated according to Canadian standards. Without this proof of vaccination submitted in advance through ArriveCan, foreign nationals traveling for non-essential purpose will not be allowed to board a flight to Canada. All of the travel and transportation measures that have been put in place because of the global pandemic are based on available data, scientific evidence, and the evolving situation in Canada and outside of our borders. This is also true for the decisions to end these measures. The health and safety of Canadians will always be our first and most important priority. La santé et la sécurité des Canadiens sont notre
Canadians' health and
priority.
safety are our top
I
priority.
want to thank Canadians who have waited patiently as we carefully and gradually remove transportation and travel restrictions. I also want to thank the airlines, airports, and all workers in the aviation sector. The sector has endured a lot during the pandemic. Our government was there to support airlines and airports, but nothing beats working together to restart travel. I ask travelers to be patient during this transitional time. As volumes ramp up, there might be longer wait times than usual as airports adjust to the new reality. The global pandemic is not over yet. We need to remain vigilant and cautious. We don't want to squander the hard-won gains made by Canadians. Today's announcement is great news for the aviation sector and its workers. Transport Canada is committed to facilitating a safe restart of travel by working with industry and all Canadians. Thank you. Merci. And now I pass on the mic to my friend, Minister Mendicino.
Merci, Omar, and it's a pleasure to be joining
Thank you,
you
Omar.
and all of our colleagues virtually from the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh. It goes without saying that the past year and a half has been difficult for all Canadians. And similarly, there have been challenges for those wishing to come to Canada to work, study, or otherwise begin a new chapter of their lives here. That's why, within our border measures, we've created pathways to allow families to reunite, students to come back to campus, and essential workers to keep driving our economy forward. And if they're fully vaccinated, today's announcement will make travel more simple and efficient for all travelers. S'ils sont complètement vaccinés, ces mesures faciliteront l'entrée au pays de plusieurs cohortes de nouveaux arrivants, et en particulier les étudiants internationaux. With less than 8 weeks until classes start this fall, we will soon welcome back international students. International students make exceptional contributions in communities large and small across Canada, bringing tremendous social, cultural, and economic benefits to Canada. That's why we've made extensive efforts to ensure that they can keep studying despite the disruptions of the pandemic. But the health and safety of Canadians remains our top priority, so we must ensure that international students wishing to travel to Canada for in-person study follows very closely all public health measures. Ils devront notamment s'assurer qu'ils disposent des documents valides et qu'ils sont inscrits dans un établissement
that they are
d'enseignement ayant un plan de préparation au COVID-19 approuvé. Les étudiants internationaux doivent toujours avoir un plan de quarantaine, même s'ils pensent répondre aux critères de vaccination complète. Ceux qui ne sont pas vaccinés doivent rester en quarantaine pendant 14 jours et ceux qui pensent être vaccinés doivent quand même avoir un plan de quarantaine. Ils doivent fournir une preuve de vaccination sur papier ou en format numérique, en anglais ou en français, ou une traduction certifiée de leurs documents et qu'ils devront télécharger ce document ainsi que d'autres informations obligatoires dans Arrive Can 72 heures avant leur arrivée au Canada. But today's announcement isn't just significant for international students. These changes will directly and positively impact pathways for economic immigrants, families, and in the humanitarian resettlement space. This announcement has been made possible because we have together collectively come so far and have made lasting progress in our fight against the pandemic. And for that, I want to thank all Canadians. Everyone's diligence, sacrifice, and hard work means that we can once again to begin to carefully reopen our borders. Safely and responsibly, we will continue to welcome newcomers and cast our eyes towards our economic recovery and a bright future. Thank you, merci, and I will now turn it over to Minister LeBlanc.
Merci beaucoup, Marco.
Thank you, Marco.
Alors, comme vous avez entendu de mes collègues, à compter du 9 août, les citoyens et les résidents permanents des États-Unis pleinement vaccinés pourront entrer au Canada pour un voyage discrétionnaire à condition qu'ils soient présentement résidents des États-Unis et qu'ils arrivent en provenance de ce pays. Cette mesure sera suivie le 7 septembre par la réouverture de notre frontière aux voyageurs entièrement vaccinés en provenance de n'importe quel pays, à condition qu'ils remplissent les conditions d'entrée prévues. La date d'entrée plus hâtive du 9 août pour les citoyens et les résidents permanents des États-Unis entièrement vaccinés tient compte de notre frontière commune et de notre relation privilégiée avec notre voisin du Sud. C'est donc dire que les voyageurs américains vaccinés pourront visiter le Canada. Mais il faut souligner que les États-Unis n'ont pas annoncé pour le moment une mesure réciproque de réouverture de leurs frontières. Chaque pays établit ses propres règles et règlements. Et de notre côté, nous avons convenu que toute mesure éventuelle visant à ajuster les restrictions sera fondée sur la science ainsi que sur le risque potentiel pour la santé publique et la capacité opérationnelle à la frontière. Nous continuons à avoir des échanges réguliers avec nos partenaires américains pour assurer la sûreté, la sécurité et le bien-être économique de nos deux pays respectifs. Si jamais la situation venait à évoluer de manière drastique, nous sommes prêts à adapter nos mesures frontalières en fonction des besoins. Tous les voyageurs devront tout de même présenter un test négatif à la COVID-19 avant l'embarquement à leur point de départ. Pour ceux et celles qui sont pleinement vaccinés, nous opterons dorénavant pour un dépistage aléatoire à leur arrivée. Donc, seuls les voyageurs sélectionnés devront se soumettre à un test au jour 1 de leur séjour au Canada. De plus, À partir du 9 août, l'obligation de séjour de 3 nuits dans un hôtel autorisé par le gouvernement sera éliminée pour tous les voyageurs aériens. Les voyageurs pleinement vaccinés, les voyageurs non pas pleinement vaccinés, pas entièrement vaccinés, pourront alors se rendre directement à leur lieu de quarantaine pour y effectuer leur quarantaine de 14 jours. Dans le cas des familles qui voyagent avec des enfants âgés de moins de 12 ans, ces derniers seront exemptés de la quarantaine obligatoire, mais devront se conformer aux mesures de santé publique. Ainsi, ils pourront accompagner leurs parents ou leurs tuteurs jusqu'à destination, à la condition qu'ils évitent des groupes, par exemple, dans les camps d'été, les écoles ou les garderies pendant 14 jours. Aucun changement n'est apporté aux exigences en matière de dépistage pour les voyageurs non vaccinés ou partiellement vaccinés. Voici maintenant ce que vous devez retenir des commentaires de mon collègue, le ministre des Transports. Les vols internationaux de passagers à destination du Canada seront désormais autorisés à atterrir dans 5 aéroports additionnels canadiens. L'aéroport d'Halifax Stansfield, l'aéroport Jean-Lesage de Québec, l'aéroport McDonald-Cartier d'Ottawa, l'aéroport James Armstrong Richardson de Winnipeg et l'aéroport d'Edmonton. Plus tôt ce mois-ci, nous avons supprimé l'obligation pour les compagnies aériennes d'effectuer un contrôle de température avant le départ des passagers aériens internationaux arrivant au Canada. Avec l'amélioration de la situation de la santé publique, nous éliminons également le contrôle de la température avant le départ pour les passagers aériens domestiques et les passagers au départ du Canada sur les vols internationaux, ainsi que pour les employés des aéroports. Et les exigences de contrôle de la température seront complètement éliminées à compter du 9 août. J'annonce également aujourd'hui que la restriction des vols commerciaux et privés directs de passagers vers le Canada en provenance de l'Inde est prolongée de 30 jours jusqu'au 21 août. Bien qu'il y ait eu des progrès, la situation en Inde demeure inquiétante. Cette extension protégera mieux les Canadiens contre une introduction accrue du variant Delta qui est répandu en Inde. De plus, les passagers qui partent de l'Inde pour le Canada via une route indirecte doivent toujours obtenir un résultat de test COVID-19 valide d'un pays tierce avant d'embarquer sur un vol à destination du Canada. Et finalement, à compter du 9 août, les transporteurs aériens commenceront à vérifier que les voyageurs venant au Canada ont soumis leurs informations sur la COVID-19 numériquement via l'application ou le site web d'ArriveCan avant d'embarquer sur un vol. Cela comprend des informations et des documents démontrant qu'ils sont pleinement vaccinés. Cela s'appliquera d'abord aux citoyens américains et aux résidents permanents qui voyagent au Canada à des fins discrétionnaires ou facultatives à compter du 9 août, ainsi qu'à ceux et celles de Saint-Pierre et de Miquelon. Toutes les mesures de voyage et de transport qui ont été mises en place en raison de la pandémie mondiale sont basées sur les données disponibles, les preuves scientifiques et l'évolution de la situation au Canada et à l'extérieur, évidemment, de nos frontières. C'est grâce à ces efforts, les efforts des Canadiens, que nous pouvons annoncer ces allègements aux mesures sanitaires. En date d'aujourd'hui, 70% de notre population a reçu au moins une dose de vaccin contre la COVID-19 et 50% des Canadiens sont pleinement vaccinés. Continuons nos efforts afin d'atteindre un taux d'immunisation encore plus élevé. Surtout, n'oubliez pas d'aller vous faire administrer votre deuxième dose afin de vous protéger et protéger vos familles. Merci. We're obviously now happy to take your questions. So, Jean-Sébastien, over to you.
Merci beaucoup, Monsieur le ministre. Donc, tel que mentionné, on va maintenant passer à la période de questions. Ministers will now be happy to take your questions. As usual, it will be one question and one follow-up per journalist. Donc, comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time for any questions. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And our first question, notre première question est de Richard Zussman from Global News. Please go ahead. La parole est à vous.
Ministers, I know ultimately this is up to the United States, but what understanding do you have from them around when Canadians will be able to travel for recreational reasons across the border?
Perhaps if I may begin to answer that question, subject to any additional information my colleagues may have. I spoke last Friday to Secretary Mayorkas, the Secretary of Department of Homeland Security. We discussed, and I revealed to him the measures that Canada would be implementing at our border. He indicated to me at this time they've not yet made a decision. They anticipate their current measures will likely be rolled over on July 21st. They are obviously considering additional measures and data, but at the present time, they have not indicated a plan to make any changes in their current border restrictions that are in place.
Follow-up? Have there been any conversations around how to treat Point Roberts? I know it's a small community, but one that has struggled through this, and whether there will be any exemptions for them around the PCR test in order to travel through Canada to get to the other side, to the United States, in order to do medical appointments or shopping or anything else that they may need to do on the mainland of the U.S.?
And if I may, Richard, respond to that as well. We've had a number of conversations, both with officials in the United States and with BC officials, very sensitive to the very difficult circumstances. Communities like Point Roberts, they're not alone in this, but their circumstances are certainly challenging. With the new measures that were introduced, first of all, Canadians will be able, if they are allowed entry into the United States, to go to the United States and to return if fully vaccinated, exempt from quarantine, and effective August the 9th. The residents of Point Roberts will be able to come to Canada, and they'll be able to enter into Canada if they are fully vaccinated and meet all of our other requirements. If they have a they'll still require the pre-arrival test, but that test will be valid for return to the United States and be valid for a full 3 days. We believe that this will facilitate not perfectly, but it's a significant improvement for the people in that community to be able to travel into Canada. They're immediately adjacent, obviously, to Canada to attend for purposes of doctor's appointments, shopping, visiting with family and friends. These are very integrated communities, but we believe that the measures that we will introduce effective August the 9th will be a significant benefit to the people who have faced very difficult challenges during the existing restrictions. Thanks.
Thank you, Minister Blair. Operator, next question. Opérateur, prochaine question.
The next question, la prochaine question est de Lina Dib de la Presse canadienne. Please go ahead. La parole est à vous.
Merci. Minister Haidu, my question is for you. I wonder if you could specify again the stat, because I heard two different numbers of how many Canadians got their first dose and how many their second. And could you explain to me, once you give me those numbers, why you stepped away from that threshold of 75% that the Prime Minister was talking about not so long ago, saying that we need to protect Canadians here, and it depended on how many Canadians here are vaccinated and not about how people are vaccinated outside of here. So could you explain to me why you stepped away from that 75%? Where's the science in that?
Thank you very much. Merci pour la question. C'est très important de reconnaissance que ces mesures aujourd'hui pour les personnes qui sont tout vaccinées. Today's announcement is really about international travelers, Americans, and later international travelers that are fully vaccinated. We are not changing our measures at this time for individuals that are not fully vaccinated. And of course, this is based on emerging evidence from around the world that vaccination does provide a high degree of protection for individuals for both contracting and therefore transmitting COVID-19. We'll be, of course, monitoring the data at the border, and we have actually, since we've been allowing for vaccinated Canadians to forgo quarantine just recently. And of course, we see in those numbers of the 63,000 fully vaccinated Canadians that have re-entered Canada, a handful of people have tested positive, in fact, under 10 individuals. So, you know, the data that we're basing the decision on today is really about a growing sense of the protection of vaccination, both for infection and for onward transmission. The numbers I quoted today, it's as of today, nearly 80% of eligible people in Canada have received at least one shot of COVID-19 vaccines, and over 50% are fully vaccinated. So we can see that we're on the right path in terms of our own vaccination campaign. It is why we're proceeding carefully with this announcement today of the resumption of entry into Canada for fully vaccinated individuals, both from the U.S. and later on for international travelers.
Okay, so as my follow-up, I hope you still can hear me. So when you say you're going to be watching and are ready to change whenever something happens, what would be the trigger for changing the rules once again? What would be the changing the rules in a way of, you know, closing up more? What exactly will you be watching for?
Il y a trois buckets qui nous regardons pour ces décisions. There are three real kind of buckets of data, if you will, that the Public Health Agency of Canada is monitoring very closely to make advice to the Government of Canada, to provide advice to decision makers about any changes of stance on the border. One would be our own immunization campaign. How are we proceeding to that ultimate goal of the best protection for Canadians possible? And, you know, obviously, we've talked about 75% fully vaccinated, 80% fully vaccinated. Of course, the more people that are fully vaccinated, the more we can protect this new normal that we see ourselves in just about every province. Secondly, we're watching our own domestic data. What are the case rates in the provinces and territories? Are we seeing a rise in hospitalization or even worse in ICU rates or deaths? These are very important metrics that we constantly monitor with provinces and territories. And of course, we work closely with those premiers as well as ministers of health and the medical officers of health from each province and territory to understand their own situation and their own concerns or strengths as it may be. And then finally, of course, monitoring the international data. Do we see the rise in potentially more infective variants that are emerging and creating breakthrough cases in fully vaccinated individuals? What is the state of our international partners' vaccination campaigns, and what is the state of the pandemic? We know this virus has thrown us many curveballs internationally and here in Canada over the last almost 2 years now, and so all of those data points are constantly monitored by the Public Health Agency of Canada.
Thank you, Minister Hajdu. Operator, next question. Opérateur, prochaine question.
Thank you. Merci. The next question. La prochaine question est de Peter Cohen from CBC Newfoundland and Labrador. Please go ahead. Your line is open.
Thank you. A question about the types of vaccinations that are acceptable. Right now, Canada is only accepting any of the approved vaccines. Why is it not accepting other vaccines that may be WHO approved, especially when there are Canadians who are going to be traveling to other countries where we're hoping and expecting that they will recognize vaccines, even though they may not be approved locally?
Thank you very much for the question. And I will say, first of all, that Canadians have sacrificed a tremendous amount over the past 2 years to keep each other safe. And that's why we're so carefully guarding the progress that we've made. It is also why we're being very cautious around what vaccinations we'll accept as proof of vaccination at the border. Of course, we know that the WHO does have a list of vaccines that they consider safe and effective, and we're monitoring that data with our international partners. And certainly we will adjust our stance as our officials feel comfortable to do so. Again, this approach that we're taking is really built on A, protecting the gains that we've made as a country, and B, using the best possible science and evidence to make these decisions going forward.
And the follow-up to Minister LeBlanc about Saint-Pierre-and-Miquelon, I heard him briefly mention it in his French remarks, but I'm wondering, can you explain what will the rules be for folks from Saint-Pierre and Miquelon that want to be able to travel back and forth, especially to Newfoundland and Labrador?
Well, thank you for the question. And I, in fact, spoke with the French ambassador to Canada earlier today to inform her and the French Consul General who's resident in Moncton, that we would be making these changes. And there's similar changes that will apply to American citizens or permanent residents of the United States. The Prime Minister received a letter from Premier Fury of Newfoundland and Labrador expressing support for including the residents of Saint-Pierre-and-Miquelon, the French citizens who are resident at Saint-Pierre-and-Miquelon, for allowing them to more easily, as you noted, take, for example, the ferry to Fortune, Newfoundland, or we hope some of them will fly to Halifax. They will be subject to the same rules that will apply, as I said, to Americans. The French ambassador confirmed to me that they're able to do PCR COVID tests on the islands of Saint-Pierre-and-Miquelon, so they will have to have a negative test before arriving in Canada. And if they're fully vaccinated, as a great percentage of them are, they will not have to be subject to a quarantine rule, and they can visit Canada. So we think of those thousands of people that have been on those islands in the Gulf of St. Lawrence for the last 18 months, and we look forward to welcoming them safely to Canada after the 9th of August.
Thank you, Minister LeBlanc. Operator, over to you. Opérateur, à vous pour la prochaine question.
Thank you. Merci. The next question. La prochaine question est de Boris Proulx du journal Le Devoir. Please go ahead.
La parole est à vous. Le Devoir. Please go ahead.
Bonjour, Monsieur le ministre. Vous avez dit que vous avez présenté votre plan à vos homologues américains. J'aimerais juste avoir la précision suivante. Est-ce que vous leur avez demandé d'ouvrir aussi leurs frontières aux citoyens canadiens?
To open the border to Canadian citizens on their end as well?
Peut-être vous me permettez de répondre à la question. Comme mon collègue, le ministre Blair, a bien mentionné, ça fait évidemment des mois et des mois que nous avons des discussions avec l'administration américaine, avec le gouvernement américain quant aux mesures aux frontières. Depuis le début de la pandémie, nous avons collaboré avec le gouvernement américain afin de protéger les citoyens de nos deux pays respectifs. Nous comprenons que les Américains vont prendre des décisions quant à l'ouverture de leurs frontières pour les voyages discrétionnaires. Nous espérons qu'au bon moment, le gouvernement américain va pouvoir évoluer leurs mesures aux frontières. Cependant, nous respectons que c'est leur décision. Nous les avons informés, évidemment, avec des décisions que nous annonçons aujourd'hui, mais nous attendons que le 21 juillet, ils renouvelent leurs mesures aux frontières, quitte à peut-être évoluer les mesures au cours des prochaines semaines, mais nous allons continuer de travailler d'une façon privilégiée avec les Américains et nous espérons avoir de leurs nouvelles bientôt.
Merci. En suivi, le 9 août, ce sera terminé les quarantaines obligatoires à l'hôtel désigné par le gouvernement fédéral pour tous les voyageurs. Je voulais vous demander si, en rétrospective, en regardant ce qui s'est fait, si ça n'avait peut-être pas été la meilleure décision de votre gouvernement d'avoir mis ça de l'avant.
Moi, je pense que nous avons, comme la ministre Haidu a dit et comme d'autres ont répété, nous avons depuis le début de la pandémie, nous avons pris les mesures nécessaires pour protéger les Canadiens et les Canadiennes. Nous allons jamais nous excuser pour avoir pris des mesures importantes pour protéger les Canadiens. Vous vous rappellerez que pendant plusieurs mois, les députés d'opposition, comme les premiers ministres de plusieurs provinces, nous ont demandé de restreindre et d'éliminer des voyages, par exemple, non essentiels vers certaines destinations. Nous avons pris nos décisions basées sur les avis scientifiques, les avis des médecins, mais nous avons aussi pris des décisions importantes pour envoyer un message aux Canadiens, surtout l'hiver passé, que ce n'était pas le temps de faire des voyages ou des vacances, par exemple, à l'étranger. Nous avons continuellement répété ces conseils-là et nous avons pris les mesures globalement que nous avons jugées appropriées pour restreindre et limiter les chances que les Canadiennes soient sujets à des cas de COVID ou à l'importation des infections de COVID-19 aux frontières internationales. Et je pense, vous serez d'accord, que la recherche a démontré que les mesures aux frontières ont été très importantes pour effectivement réduire et presque éliminer l'importation de la COVID-19 de l'étranger. Et c'est ça qui était pour nous la priorité depuis le début de la pandémie.
Merci beaucoup, Monsieur le ministre. Opérateur, à vous pour la prochaine question. Over to you, operator, for the next question.
The next question, la prochaine question est de Mackenzie Gray from CTV News. Please go ahead. Your line is open.
Hi, my questions are for Minister Haidu. Obviously, in the announcement today, you're making changes about kids under 12 no longer needing to quarantine. Why is the government not changing that right now for Canadian citizens? Because there's many families who live outside the country who are Canadian citizens who would love to be able to come back to Canada and see their grandparents and other family members. Why is that change not immediate?
Well, the changes are taking place as we've announced on the dates that we've announced to make sure that we have the appropriate operations in place to both monitor parents and families that have children. Of course, these families will still receive check-ins to make sure that they are abiding by the public health measures. But more importantly, Mackenzie, we're taking these measures with the confidence in Canadians that they will abide by the new rules. We understand that it was quite a hardship for families to quarantine with their children for those 14 days. These relaxed measures do allow parents to bring their children with them on errands, for example, but ask parents to avoid bringing their children to not bring their children to areas where there's congregations of people, including schools and playgrounds and daycares. And why is that important? That's important because, of course, children can catch COVID-19. They can become very sick with COVID-19 and they can transmit COVID-19. And we want to protect the upcoming school year. Children still are not able to be vaccinated. We don't have any pharmaceutical companies yet who have applied for a vaccine for children. Of course, we'll eagerly review those applications as they come in. But children remain vulnerable, and so do their communities. And so this measure allows for families to have some degree of functioning, for example, as I said, to be able to take care of the kinds of activities they need to, but also we expect that parents will continue to protect their communities and their families at large. Thanks.
There are a number of people who have received a mixed schedule of vaccine, whether it be a shot of AstraZeneca first, Pfizer second, or mixing and matching mRNA vaccines. Are you concerned that countries that are using vaccines that Canada has not approved, such as Sinopharm or Sputnik, will not allow Canadians in who received a mixed dose as a retaliatory measure for the fact that we're not allowing people in who used their vaccines?
Well, I can't speak to the motivations of other countries, but I can speak to ours. And we have been, as I said, very rigorously following the advice of our public health authorities, who are most comfortable, as I said earlier, with accepting vaccines that we have studied here in Canada to receive Health Canada approval. Each vaccine has to go through a rigorous analysis, and we have access to all the data. So as we continue to understand the effectiveness of other vaccines that have been developed in other countries and other settings, we'll continue to work with those partners as well as the WHO. And undoubtedly, as vaccine campaigns get underway and we have better real-world data around the effectiveness of those vaccines, we will be able to adjust our measures. But for now, given that we know these vaccines, we know their effectiveness, that is the choice that we've made, and it is on the advice of our public health authorities.
Thank you, Minister Hajdu. Operator, with you for the next question. Opérateur, prochaine question. Merci.
The next question, la prochaine question est de David Youngren from Reuters, Ottawa. Please go ahead. Your line is open.
Yeah, good afternoon. Thank you for doing this. First question, you're now allowing fully vaccinated Americans in, but the Americans are not taking reciprocal measures. How long can this imbalance continue, do you think, before it starts getting politically embarrassing for the Canadian government?
Yeah, if I may respond to that, David, there's nothing about this that's embarrassing. We're introducing measures that are appropriate and appropriately cautious to protect Canadians and to begin a very careful phased reopening of our border. We work very closely with our American counterparts. We make our decisions based on the advice of our scientific experts and the situation as it evolves in Canada, and we do that in the best interest of Canadians, as do the Americans. The measures that we have adopted together as a country have been largely reciprocal and generally symmetric, but not entirely so, because each of us faces unique and constantly changing circumstances. We'll continue to work very closely with the Americans. I'm confident that as the situation continues to improve in their country, that we'll be able to maintain, a reasonable balance in the measures. But we're doing what's right for Canadians, and we're doing it based on the advice that we're receiving from Canadian medical advisors.
Thank you. And secondly, perhaps a question to Minister Hajdu. The Delta variant seems to be spreading rapidly in the States. The British government is engaging in an opening up program, which has been widely criticized. I know you say that only fully vaccinated people will be allowed in, but what would you say to people who think this is just too much of a risk, to allowing people in from Britain and the States, given what's happening with Delta?
Well, thank you for the excellent question. And, your question reflects the thinking that we've had guided again by the public health authorities. And that is why we continue to maintain that all travelers are required to do a pre-departure test, regardless of their vaccination status. This also helps to eliminate any asymptomatic infections in vaccinated individuals who might not think that they have contracted COVID-19. And again, I'll point to the early but emerging data from the earlier measures that we put into place to allow fully vaccinated Canadians to enter without the requirement to quarantine. And of the over 63,000 Canadians that have entered with those relaxed measures, and with full testing, by the way, on day one, we've identified under 10 individuals that have been positive. These are infinitely small numbers. Nonetheless, your question also speaks to the need to continually monitor that data, not just at the border, but certainly our own domestic data and the learnings of the many international partners that are very unfortunately seeing a significant increase in infections, including the United States.
Thanks.
Thank you, Minister Hajdu. And operator, over to you for the last question today. Donc, opérateur, à vous pour la dernière question.
The next question, la prochaine question est de Juliane Lapointe de Radio-Canada. Please go ahead. La parole est à vous.
Bonjour, j'aurais une question concernant les enfants. Vous dites que les enfants n'auront plus à faire de la quarantaine obligatoire, mais qu'il sera conseillé d'éviter les lieux collectifs. Est-ce que vous pouvez préciser qu'est-ce qu'on entend par un lieu collectif? C'est compris là-dedans, puis est-ce que c'est peut-être un peu flou finalement comme directive qu'on envoie?
Ben, Juliane, peut-être je peux offrir des précisions et si d'autres collègues veulent ajouter par après. Je pense que nous avons dit et nous comprenons très bien la situation de familles qui voyagent, surtout après ces mois tellement difficiles et qui ont des enfants qui n'ont pas pu se faire vacciner parce que pour le moment, les vaccins ne sont pas approuvés pour les enfants. Alors, nous sommes conscients de cette situation difficile pour les familles qui veulent quand même voyager d'une façon sécuritaire. Alors, les conseils que nous avons eus, par exemple, de la Dr Tam et d'autres, c'est qu'il n'y aura pas de quarantaine obligatoire pour les enfants, une quarantaine de 14 jours, s'ils sont accompagnés, évidemment, des parents ou d'un tuteur qui est pleinement vacciné. Mais les consignes sanitaires des autorités provinciales ou locales devront quand même s'appliquer. Alors, les familles vont prendre conscience des mesures locales qui s'appliqueront. Et aussi, nous allons évidemment déconseiller des visites de ces enfants-là dans des endroits comme des garderies, comme des écoles ou comme d'autres endroits où il y a énormément de capacité de transmettre la COVID-19 si jamais il y avait un enfant qui avait la COVID-19.
Question de suivi, Julien.
Follow-up question, Julien?
Oui. J'espérais que d'autres enchaînent, mais bon, c'est beau, je vais y aller avec une autre question. Concernant maintenant les vaccins, je comprends que les discussions sont en cours avec les États-Unis, tout ça, mais il reste quand même l'inquiétude chez certains Canadiens qui espèrent bientôt être capables de voyager aux États-Unis, mais qui ont reçu une dose d'AstraZeneca, une autre dose d'un autre vaccin. Est-ce qu'on craint que les Canadiens qui ont reçu 2 vaccins différents comme ça soient pénalisés, qu'il y ait de la difficulté à voyager? Est-ce que ça aussi, ça fait partie des discussions avec les États-Unis?
Sûrement, Juliane, dans nos conversations avec les autorités américaines, on discute évidemment des mesures aux frontières, mais il y a aussi une discussion continuelle sur ces enjeux-là en termes de vaccins, en termes de qu'est-ce qui constitue quelqu'un qui est pleinement vacciné. Nous échangeons continuellement avec des autorités, pas simplement aux États-Unis, mais aussi dans beaucoup d'autres pays, afin idéalement d'arriver à une reconnaissance mutuelle des régimes de vaccination, évidemment basés sur les données scientifiques et l'analyse de nos autorités de Santé Canada. Mais je sais que les autorités de Santé Canada parlent très souvent, évidemment, avec leurs homologues américains, précisément pour arriver à une conclusion appropriée qui ne va pas devenir un empêchement, comme vous avez dit, pour un voyage potentiel pour un Canadien ou une Canadienne qui a suivi effectivement les avis et les conseils de leurs autorités sanitaires dans la province ou la juridiction où ils habitent.
Merci, Monsieur le ministre. Donc, voilà qui met fin à cette conférence de presse. That will mark the end of today's press conference. Thank you for being with us. Merci d'avoir été parmi nous.